The 2 years since our last convention will undoubtedly be defined by COVID-19. The pandemic has disrupted our lives, it's altered every aspect of our work, and it's taken a toll on our mental health. Back in January of 2020, the CFNU was already bracing for the worst.
My responsibility is to work with government. Yours is to be prudent and get ready.
Just like we did during SARS in 2003, H1N1 in 2009, and the Ebola scare in 2014, the CFNU advocated for caution. We took that message to government and we implored them to protect nurses. Meanwhile, we issued a number of position statements and a video to make sure nurses knew about their right to ask for proper PPE. When the situation became especially critical, the CFNU called on the federal government to invoke the Emergencies Act.
It's time the federal government steps up and brings everyone together just to look at healthcare.
Meanwhile, the CFNU retooled and brought you over 30 Facebook Live events to keep in touch during the pandemic.
Hopefully, you know, I'm Linda Sloss, National President for the Canadian Federation of Nurses Union, and you're here on my Facebook Live.
For nurses working out there, healthcare workers, big virtual hug. Everyone stay safe, wash your hands, wear a mask.
By June, it was clear that there had been a major system breakdown. PPE had been in short supply, long-term care had been devastated, and governments had failed to apply the lessons from SARS. What we needed was an independent investigation, and so the CFNU recruited Mario Passamay, the former senior advisor to the SARS Commission, to lead that inquiry.
We're going to move quickly over the summer. We're going to listen. We're going to find out what's going on, and we will make sound, urgent recommendations.
Published in the fall of 2020, the 273-page report captured headlines and made dozens of important recommendations to ensure that the mistakes of the past would not be repeated.
A precautionary approach says that, where there is uncertainty, you act on the side of safety. And that's at the center of looking after healthcare workers.
Stopping COVID-19 was always going to require the public's help. Throughout the pandemic, we called on Canadians to follow public health guidance to stem the spread of the virus and ease the stress on our healthcare system. More recently, to combat vaccine hesitancy, the CFNU launched a nationwide campaign encouraging everyone to trust nurses and get vaccinated when it's their turn. As the pandemic took hold, we recognized that nurses were going to need immediate help with their mental health. In May of 2020, the CFNU released a report revealing high levels of mental health disorder symptoms among Canada's nurses. The data had been collected pre-pandemic.
But as the crisis abates, I think we're going to see the real toll that this has taken on nurses and a lot of our critical frontline staff members.
Since then, the CFNU has worked with Wellness Together Canada and other organizations to bring nurses the self-help tools and mental health resources that they need. Our work also continued on another important issue facing nurses, violence. Shortly after the House of Commons Standing Committee on Health published its 2019 report on violence facing healthcare workers, the CFNU met with premiers to call on provincial governments to do their part to protect nurses. 2019 was also an election year. The CFNU ran an aggressive ad campaign encouraging Canadians to vote for care, with PharmaCare improving long-term care, stopping violence in healthcare, and increased healthcare funding topping our list of demands. And our nurse union leaders, they took center stage to get nurses to the polls.
Go out and vote this federal election.
Go vote. Don't forget to vote. Did I tell you to vote? I want you to go out and vote.
Meanwhile, our work on PharmaCare continued to be a top priority. In 2019, the Advisory Council on the Implementation of National PharmaCare agreed with us that Canada needs a universal, single-payer public PharmaCare.
I truly believe, the Council truly believes, that National PharmaCare's time has come.
In February 2020, we were proud to stand alongside NDP leader Jagmeet Singh as his party introduced Bill C-213, an act to enact the Canada PharmaCare Act. With that bill getting voted down earlier this year and no funding for PharmaCare in the 2021 budget, nurses' voices are still desperately needed to make PharmaCare a reality. The CFNU has also been hard at work calling attention to the national nursing shortage. In December 2020, we released the Outlook on Nursing report, which shed light on nurses' work environments. The CFNU is now working with Dr. Ivy Bourgeau, a leading expert in health human resources planning, to force government action on this issue.
So we need a multiple intervention strategy that focuses on all of those levels, but it includes health workforce data and includes supports, for nurses at the point of care and all of those steps in between.
Last year, we were also reminded that there's still a lot of work to do around equity. The tragic death of Joyce Echaquan showed us that we all have a role to play in combating racism and creating welcoming and affirming healthcare spaces.
Society is saying this is unacceptable, and I think we have so much influence and trust in society as nurses that we need to utilize that.
In 2020, the world stood together and said Black Lives Matter. The pandemic, meanwhile, disproportionately affected Black, Indigenous, and people of color, showing clearly that systemic racism is a healthcare issue. As nurses, we can be part of the solution. The last 2 years have been difficult. They've been tumultuous and punctuated by loss. But perhaps now more than ever, Canadians see the value of a strong public healthcare system and the invaluable role of nurses. We will overcome this pandemic, and with the support of the public at our backs, we will build a healthier and more equitable Canada.